Welcome back. COVID-19 is an ever-evolving virus. Once again, we're looking at some new strains circulating. The FDA is reviewing updated versions of the booster shot to fight these variants. Dr. Payal Kohli joins us this afternoon talking about the current state of COVID-19. What is the current, where are we at with strains at this point?
I keep hearing more and more cases.
Yes, and it's hard to keep track of where we even are in the evolution of this thing.
You know, it keeps evolving, and what's different about the current variant, the reason that it's caught our attention is because the last few variants, when they evolved, it was the 1 or 2 mutations that changed. This has over 30.
Oh my gosh.
And it's called a massive evolution. And the last time we saw this was when Delta was born, which was obviously a very bad strain. All of those mutations are localized to the spike protein, which is the arm of the virus, what it uses to get inside our cells. It's also the part that our immune system makes antibodies to if we've had infection or if we've had the vaccine. So we worry that this may be more likely to infect people who've already been vaccinated or those that have already been exposed. We're waiting to see if it makes people sicker, but thankfully early on it seems to suggest that it's not doing that.
So is this part of the Omicron? I mean, what are the scientists saying? Where do they connect this one? It's not Delta.
It's not. So Omicron, think of them as the grandparents. And these are sort of a couple of generations down. So they're cousins. The XBB variant, which is the one we're going to make the booster against that's coming up, and this one, which is BA.2.86, they're cousins. So just like we kind of look like our cousins and act like them, but not entirely similar, there is a little bit of overlap, but it's not the same. But you know, what's different now is that people aren't testing as much. So the way for us to know what the virus is doing is to look at hospitalizations, which are recently going up, also to look at wastewater, which is something else scientists are doing to sort of track what's going on with the virus.
So you'd mentioned the new booster. There's one coming out next week, and it will cover one of the new variants, we believe?
So it only has a single strain in it. It's a monovalent booster. Remember how the last one was bivalent because it had the Wuhan strain and it had the Omicron. This is only XBB, Omicron XBB. But new data from Moderna and Pfizer tells us that it's looking like it's mounting really good antibody responses, even against this BA.2.86 because they're cousins. Now this data hasn't been peer reviewed yet, but that is very reassuring that at least it seems to be cross-reacting in terms of the immunity.
So we are hearing about these cases. I'm hearing about little kids. They're all back in school, older people as well. Should we be putting the masks on? Should we be just washing our hands more? What's your advice?
With the hospitalizations going up, which is the way we're now tracking the disease, remember, the older people, the immunocompromised people, those with medical problems do need to put the mask back on in crowded indoor spaces. So if you're sitting with your family, close friends, probably not. But if you're going out to the grocery store, you're going to the shopping mall, going to the bank, it's probably a good idea to put those masks up. And again, we have to be dynamic this season because now this virus has become endemic. We're living alongside it. It's not a pandemic. We have antivirals, we have vaccines, but we do need to protect ourselves with those mitigation measures. So wash those hands, Kim, like you said, flu season, RSV, everything is on its way in. We've already seen a surge in RSV hospitalizations, but also go get those boosters. And who should get those boosters? Pretty much everybody, if you've been at least 3 to 6 months out from your last infection or your last booster. So for sure, the older immunocompromised people need them. The young, healthy people may say, I don't need it. But you know, flu season is coming, winter virus season is coming. Give your immune system a little boost.
Because otherwise you're sure to get sick for the holidays.
Yes,
right.
And only around the holiday that matters the most to you, that you have the flights booked for. My last question is, it's always tricky every fall, I feel like, to time these booster shots and the flu shots. What's your advice on timing and getting everything at the same time?
So mid-September would be a great time. So these boosters, the updated booster, don't go today because you won't get the updated one, but once the FDA greenlights that updated XBB booster, you go get the booster and the flu shot around the same time. If you're over the age of 60, you should also get the RSV vaccine. This is the first season that we have that. You definitely want to get it before Halloween. So my little mnemonic is flu before boo. So make sure you get it before that happens. But you can get all 3 of them at the same time. Just make a quick trip to the pharmacy or the doctor's office.
Oh, you can. You can just go, shoot me up.
One in each arm.
And maybe one in the leg.
Oh, there you go.
Okay. Well, wear shorts. Okay. Dr. Kohli, that's a lot, and I think we got to pay attention. It's all over now. All right. Thank you. We'll be right back.